Hi, I'm Dr. Sam Sunshine, and today I'm going to be your host as I talk to you about direct primary care. So first I'm going to set up my share screen. And let's get started. So direct primary care, or DPC, is a new form of healthcare that goes outside of the traditional health insurance model. Before I begin and talk about direct primary care, I'd like to share our values of our clinic. They are honesty, caring, kindness. We're passionate and compassionate. We're purpose-driven. We're loving, trustworthy, accepting, loyal. We act with integrity, and we're very health conscious. We are looking for patients who share similar values as we do. So let's talk about the direct primary care model. How is it different? If we were to compare the direct primary care model to the current health insurance model, what are some of the advanced technology that we use to make the ease and simplicity of this model so user-friendly? What are some savings you can expect with the direct primary care model? And then we try to answer some of the most common questions that we get. So first off, how is DPC different? First of all, we're very proactive, we're not reactive. We're here to help people up the hill to optimal health. We're not waiting for people to come in and contact us because they're not feeling well or need a medication refill. We have more time to spend with you. We're not restricted, like in the traditional model, where you have to see more patients to make ends meet. Oftentimes, our visits will last 30 or even up to 60 minutes in length. We focus on wellness and the 4 pillars of good health. We work for you and not for your insurance company. We have improved efficiency. Just removing the layer of health insurance improves efficiency. And we have improved health outcomes. This has been shown with clinical studies looking at patients in the direct primary care model compared to the traditional insurance-based model. Patients have lower rates of diabetes, heart disease, to give you an example. And there are long-term savings, which I will discuss later. So we compare side by side the traditional PPO contract model. Again, this can include the HMO model, Kaiser model, versus direct primary care. So that's the health insurance model, again, versus direct primary care. Usually restrictive scheduling. Doctors need to see more patients. In the direct primary care model, there's multiple scheduling options. A lot of it is telehealth and virtual care. Oftentimes there's limited contact with the doctor. You're seeing the nurse practitioner, the PA, or maybe the medical assistant. In the direct primary care model, there's direct contact with the doctor. Again, oftentimes just a phone call away. There can be expensive out-of-pocket costs in the health insurance model. In the direct primary care model, it's one flat rate for most of our services. Some of our injection therapies like platelet-rich plasma and prolotherapy are added costs. Oftentimes an office visit is required for medication refills. In the direct primary care model, oftentimes it's unnecessary to have a patient come into the office simply to refill their medication. Typically, if patients have multiple concerns, these are broken into multiple visits in the traditional model. In the direct primary care model, oftentimes we can address several visits at the same time. For instance, I had a patient earlier today. We discussed hormone replacement therapy. I was able to freeze actinic keratosis on his ear, and we discussed and reviewed his recent lab work. Oftentimes in the traditional model, there's over-testing or blanket testing. In the direct primary care model, because we have the luxury of more time with the patient, we don't order unnecessary tests. We can order more focused testing, more necessary testing. The next, I'd like to talk about some of the advanced technology that we utilize that makes the system so efficient. First, we have Spruce Health, And this is our communication platform to connect you through text, email, or video chat. We have Elation Health. This is our electronic health records with direct patient access. And then Hint Health is a secure, simplified online payment system. And all three of these systems and platforms interconnect and interact with each other. Here, I'd like to talk about savings. Again, with the direct primary care model, it's one monthly payment. And this covers most of what we provide in the office. Again, exceptions are some of the injection therapies that we provide. Most services are included. It would typically go to deductible. Again, giving an example of a patient with an asthma attack, if they come in, the exam, a spirometry test, and a breathing treatment would be at no cost. This morning, I had a patient who had an acute back injury, and she was worried about the cost of a pain medicine injection. The cost of the pain medication is free in the office. Oftentimes, no need to take time off work to discuss a health issue. This is done and handled most of the time with a virtual care visit. There's reduced dependency on emergency departments and urgent cares. We are available 24 hours a day, 7 days a week. So what are some ways you can lower your insurance premium costs? First of all, you can increase your deductible of your plan. Rather than having a low deductible, you can have a higher deductible. This will lower your premiums maybe several $100s a month, and you can apply that towards the direct primary care model. You can change the health plan you're on. We can help you with that to make a wise decision. And you can explore some of the health sharing programs. This is not insurance, but it does provide coverage for specialty care and if you are hospitalized for your hospital costs. So the biggest question we get, and one of the more challenging questions is, you know, doc, I already have insurance. Why should I join your DPC model? And again, in basic and simple terms, I'm here to be your Sherpa to take you down a path to optimal health. That is my job. I want to help you become the physician of the future. This is very different than the insurance model. You have access to a doctor who knows you and knows your health history. This is personalized medicine. This has been lost in the current insurance model. We plan your health and fitness goals. Health and fitness are my passionate topics, and I want to do what I can to share my knowledge with you so you can achieve improved health and well-being and feel better about yourself. There's adequate time to address your health concerns. I don't feel rushed in our phone calls, in our virtual visits, or our in-office visits. There's ease, comfort, and peace of mind knowing that you have a team working to keep your health high and expenses low. So I ask you, where does health fit into your life? There's family, friends, your career. Is health in the top 4? These are the people we're looking for, people who are health conscious, who want to achieve optimal health. If we look at the healthcare system in other countries, the United States has the most expensive healthcare system compared to other modern democracies. Yet, Americans have poor health outcomes and worsening life expectancy when compared to these other westernized countries. In a recent study conducted from the Commonwealth Fund, looking at 11 leading industrialized countries, the United States ranked last for health outcomes, equity, and quality, despite having the highest per capita healthcare costs. In essence, we have a broken healthcare system. The US also has the highest rate of mortality, meaning more Americans die from poor care quality than other countries that were involved in this study. One of the topics we emphasize, in addition to exercise, proper sleep, stress reduction, is the importance of food. Hippocrates at 500 BC said, "Let food be thy medicine and medicine thy food." Currently we're in a viral pandemic, and the food that people are putting in their shopping carts are oftentimes highly processed, highly refined foods. Fast food, potato chips, soda, donuts, pizza are the staple of the standard American diet. What we emphasize here at OC Sports and Wellness is fresh fruits and vegetables, beans, nuts, seeds, lean meats for optimal health. So do we really have a healthcare system? At OC Sports and Wellness, we practice healthcare, not sick care. Our goal is to keep you healthy. I love this slide because the traditional model and the mindset of people in the United States that I have come across in my practice over the last 28 years is that we rely on pills and surgeries to cure our ailments, when lifestyle changes will trump pills and procedures anytime. We need to focus more on lifestyle and, again, the pillars of good health, including sleep, exercise, nutrition, stress reduction, and connectedness to improve our health. We practice a very integrative method of healthcare in our office with an emphasis on sports medicine. We look for root cause medicine. We provide preventive care. We use specialty labs that are not traditionally taught in medical schools or residency programs. We use therapeutic injections. Again, these injections, prolotherapy, platelet-rich plasma, and mesenchymal signaling cell injections are not covered, but you get a reduced rate if you are part of the membership model. Some of the take-home points: emphasizing quality of care, convenience, simplicity, efficiency, and affordability. Quality, you get better care, better communication, and you get better outcomes. Convenience, text, chat, and virtual care visits. Simplicity, one doctor, regardless of the insurance plan, one monthly payment. Less is better. I want to thank you for listening to this webinar on direct primary care. If you need to get in touch with us, ocsportsandwellness.com is our website. We have a lot of additional information under the DPC heading. If you feel that DPC is something that interests you, please call us. There is no obligation. We can give you additional information about this topic. Thank you so much.